My daughter is definitely my inspiration, definitely my purpose. My daughter is 7, and she's a very active, very imaginative little girl. Being a good role model for her and being present in her life is the most important thing to me. What you put into your body, I think, directly manifests what your body is able to provide for you. So making sure that she has a good breakfast and a nutritious lunch and a hearty dinner, those are important to me for her to be able to be productive. Here in Oakland, we have what are called Head Start programs, which are preschool programs to prepare the children for kindergarten. And while Nia was at one of those locations, being a room parent already, being really active in the school, the teacher suggested that I come in to the program, the Nutrition Education Training Academy. And what they did was take parents so they'd be able to relate to other parents and train them for several weekends over the course of months. And then you take the information that you learned and be able to share that with the other parents of your school. Community immobilization, it's different when you have someone from your community telling you that yes, you can do it, these are the changes that I've made. It's easier to relate that way. So just taking everyday moms such as myself, and first, knowledge is power, so educating us so that, you know, we understand, so we can make the changes in our own lives. Change kind of starts at home. So doing the changes that I needed to do first in our lives in order so then I can then take that and impart that to other parents and other families. Diabetes is really prevalent in my family on both sides, my mother and my father's side. And I myself am at high risk for diabetes. I've already been classified as a pre-diabetic. So seeing the effects that it's had on my family and then on myself, that's something I directly didn't want my daughter to have to be exposed to or have to go through. And then through education, learning that a lot of it is preventable, especially through what we eat and physical activity. I felt, you know, it's my responsibility as her mother to kind of start now so that she doesn't go down that same road that me and my other relatives have. It's about accountability and it's about change. I've learned that change is definitely not easy, but it is possible. Even if you kind of fall back into old habits, sometimes just don't give up and be persistent. Being involved with the network and the things like that and having my face kind of out there, it really is an accountability measure because you have to practice what you preach. So even if you think about kind of being lax a little bit, you really can't because people are looking at you now. So being a role model now, not just for my daughter, but for other people in my community as well. You don't have to do it all at once. Sometimes that can seem overwhelming and just really daunting, but just make little steps and, you know, replace the soda with water, and instead of, you know, driving to the store, walk to the store. You know, just make a change between potato chips to celery sticks. Just start with little changes, and then from there, just build gradually. And before you know it, you've made a life change, because that's really what it is. It's a life change.
Like cabbage. I like broccoli and corn and all that stuff.
Cherie Murphy is a role model for everyday moms and other Californians who are making health a priority. She works with the Network for a Healthy California, and we strive to encourage people to eat more fruits and vegetables and be physically active every day. We want to thank Cherie and other moms for all their great work and being on the front lines for the obesity epidemic.